Welcome to the Workology Podcast, a podcast for the disruptive workplace leader. Join host Jessica Miller-Merrill, founder of Workology.com, as she sits down and gets to the bottom of trends, tools, and case studies for the business leader, HR, and recruiting professional who is tired of the status quo. Now here's Jessica with this episode of Workology.
Welcome to the Workology Podcast, sponsored by Clear Company. There's a growing awareness among the public and private sectors that worksite initiatives are imperative in nutrition education and obesity prevention. Many reports support the direct relationship between health risk and healthcare expenditure. For example, obese individuals spend over 1/3 more on health services than average individuals, according to the National Institute of Health study. Wellness programs, including nutrition counseling, can keep employees healthy and keep our healthcare costs down. Because the health and wellness of company employees and their families is always top of mind for HR leaders, I wanted to talk to an expert on how we can do better. Today, my guest is Christina Duffield-Bittner. She's a registered dietitian nutritionist, or RDN, from Wellness Coachants. Christina, welcome to the Workology Podcast.
Thank you for having me.
Can you talk a little bit about your background and then what led you to specialize in nutrition and health counseling?
Yeah, so I grew up on a farm, and so I was surrounded by fresh produce daily, but it wasn't always healthy food that I was eating. So I did struggle with my weight since I was a younger age, and I tried all different diets and stuff, and it wasn't until college that I started to get a good balance between nutrition and exercise, which led me to becoming a dietitian and a personal trainer. And then once I graduated, I went the normal route that a dietitian usually goes to is a clinical dietitian in a hospital. But while I was there, I just knew that was not for me, and I wasn't meant to be in clinical. I felt like I had more to do in society, and I wanted to help more people rather than helping them in the hospital. I wanted to prevent them from going to the hospital. So it led me to going to wellness coaches and working one-on-one in the workplace as a dietitian. And I'm so glad I made the switch. It's what the dream job that I thought I would wanted to do in my life.
Awesome. Well, I'm excited that you found your dream job. I think a lot of us in HR can relate. It's a great place to be, and wellness is definitely an area I think that all of us can improve on. I know I can. So I wanted to ask you, while we get going here, what do you see as the most predominant health issue in today's workplace, and what are we doing right, and maybe what can we do better?
Okay, so weight is an obvious thing in society. We all know that being obese and overweight has grown much more over the years. That leads to the heart disease, diabetes, thyroid issues, gastrointestinal concerns, and for the workplace, especially lack of energy, which we don't want in a workplace, and we want to prevent that. The overweight and the obesity in America is real, which I believe we got here, increased convenience stores and the fast food, but stress is huge with weight, lack of sleep, poor relationships, social media comparisons, and just like what life throws at us these days, there's a lot more for us to be doing compared to a couple of years ago. So I just feel like weight is like the start of a lot of these other health concerns.
I think all of us can relate that we probably are working more, longer, and we also have more stress. I had a previous podcast interview where we talked about how to help eliminate stress and make our lives maybe not completely stress-free, but having lowered stress levels. So I'm excited that we're diving in this topic because I think it's another piece of the puzzle.
Absolutely.
I think that many HR leaders may be concerned about things like HIPAA when it comes to the sharing of medical information. Maybe for someone who's implementing a health-focused workplace program for the first time, what should we be most concerned about?
I think it comes down to lack of trust in some of the workplaces, and that holds a lot of people back from just coming to visit first, whether it be a dietitian or going to their doctors or opening up at the workplace about their health concerns. Many think the information that they give to me will get back to their employer, so they're cautious about coming, but I make it very clear that it is HIPAA compliant, and whatever you say to me, whatever I put in my chart, it's not going to get to anybody. This is between me and the employee. So I like to clear that air right then and there. So then after that, it's kind of crazy because people really do start opening up, and it may be something from an unhealthy habit that they just don't want their boss to know, or something relationship-wise that is causing them to gain the weight. Maybe they're overeating because of the stress at home, whatever it may be. Once people know that it's all HIPAA compliant, then they're much more open. So it's very cool to see that people are concerned about that. I think it is important because trust is a huge thing within a workplace, but in life in general.
How can we tactfully support employee efforts to get healthy while maybe walking that fine line between reward and respecting the privacy of our employees?
Right. So then that comes, that's a little hard with respecting the privacy of your employees and reward and stuff, especially if you are an employer and you want to make your employees happy. With some places that I work, again, it's the trust and having respect for the employees. If the trust and the respect aren't there, the employee will never open up and will never give the employer back what they are probably looking for health reasons, and maybe what they can do better for the employees in the workplace. But another thing that employers can do for the employees is just be genuine in their efforts to help them. So if they have to really show that they care about their employees, and they're not just doing it just because they want, okay, let's call sick days out or whatever it may be. They really generally care about their employees, and the employees will see that they're genuine. They might be able to ask their employees, like, what are some health goals that you have? Maybe like a survey goes out, an email or something. And so they give 1 or 2 ways that they could try to achieve their health goals, which will then give like a bigger list for the employer to maybe start opening up about, okay, hey, listen, a lot of people think X, Y, and Z will help them. Maybe it's a program that we do. So for examples, like maybe that's a yoga workout class after work or on lunch, or 5-minute meditation, or chair massages, or bringing in a dietitian or wellness coach. Anything that will actually the employee really wants, the employer should just listen to them and see what they do want, because a lot of the employees will not come if they're not interested.
I think you're right. Like talking to the employees and asking them what they need to help support them, right? And I think I've done all these things, but I love the chair massages or the dietitian or encouraging taking time for self-care. These are things that when you're stressed and you're working a crazy schedule or you have like crazy things going on in your life, you don't necessarily even know that you need those things because you're so wrapped up in all the things that are just happening in your life in that moment.
Yeah, and you're just like going around the whole wheel of life that just doesn't stop.
Let's take a reset. This is Jessica Miller Merrill, and you're listening to the Workology podcast sponsored by Clear Company. Today we are talking about nutrition counseling and how it can be used to drive your health and wellness programs in the workplace. I'm joined by Christina Duffield-Bittner, RDN with Wellness Coaches.
This podcast is sponsored by Clear Company, the fastest growing talent management system on the market, and recently won G2 Crowd's #1 user recommended Winter 2018 award. Visit clearcompany.com to learn more.
What are some tips you'd like to offer to HR leaders and some guidance on maybe encouraging healthy behaviors? How can we approach this type of education to help them be on a path to wellness and just eating better and living a healthier lifestyle?
Yeah, I think it's great. It starts at the HR level or even higher up to notice that we need healthy behaviors, or some of the employees are really getting sick in the hospital or whatever it may be. But then we also have to look back and say, okay, a person will not take steps toward their health if they are pressured. I've seen that so many times with my clients. They will take a step when they're ready on their timing. So it may be that you're providing different resources or activities for when they are ready. If you start like a program or activity, it'll take time for the employees to try it and start to come to it. But once they hear other coworkers going to it and they hear good things about it, they'll definitely come out. But it's just the starting process might take a little bit longer than some HR leaders may think. Another good idea might be, how about you put a health forum or a committee at work for the employees? So maybe there's an employee that really loves exercise or loves to be healthy and is a good leader. Maybe they want to lead the other employees with this forum and a committee, so they might listen to their other coworkers compared to maybe HR or a head person. So sometimes coworkers are easier to approach than some HR. Just depends on the relationship within the workplace.
I love the idea of an employee-driven committee that is looking at how we can help promote a more healthier lifestyle. They're kind of driving, HR supporting, that trust factor is there. And then, like you were saying, more people are out there kind of evangelizing, sharing, laughing, having a good time, and talking up this particular program, which I would think is going to increase adoption and more employees taking advantage of these different things that we're putting in place.
Right. So it might be, instead of you go to happy hour for drinks, maybe you go to work like a yoga class, or maybe there's a fun activity that includes healthy food or something that people can get involved in. Just some thoughts.
Yeah. No, in Austin right now, they have this entire month that is just driven around getting outside and getting active. And there's a lot of different employers and businesses that are taking a part of it. And so I'm seeing a lot of stuff on the social media feeds about a lot of my friends who are doing different things and taking part in those things. Me, I don't work for a large employer, but that doesn't still mean that I can't get out there. I love paddleboarding. I think there's a lot of different things that you can do to help, get a little bit of exercise, eat better, and feel better.
Absolutely. That's an awesome idea that they have. I love that.
Yeah, we'll link to it in the transcript of the podcast. Austin is such a great place. I've lived here almost 2 years, and there's always some hiking, goat yoga, paddleboarding, crazy stuff happening here. And it is so easy to just get out and be a part of the community and then get that exercise that you need.
Perfect.
What do you think is the most effective or unique program that you've seen implemented to encourage employees to focus on their health?
So I've just been working for the company for, it's going to be a year in August. We've done, me and the wellness coach. More, the wellness coach does a lot of the program, but we work together. And she did a program during the holidays, Maintain, Don't Gain. It was a great program because the employees make groups of 2 or 3, and they hold each other accountable. They make a name for their group, which they're pretty funny, and they just have fun with it. And then through the 3 to 4 months, they can get raffle tickets if they do their blood pressure, if they get on the scale, if they see me, which is the dietitian. And there's a few other opportunities for them to get a raffle ticket. During each month, we put the raffle tickets in a basket and we pick one out, and they win a gift card. The final prize, the winner wins a Fitbit. And the employees really enjoy this because they have each other and they're holding each other accountable during the holidays, which we all know the holidays are a very hard time to maintain and not gain our weight. So I always find that getting people involved and making a group that they can hold each other accountable has shown to be fun for them and competitive, because there's some competitive people in the workplace, but also have them be more mindful throughout the hard seasons that are hard to be healthy.
I love this idea because at the SHRM annual conference, they have a step challenge for everyone who's in attendance, and you participate, and they have team leaders and groups. And for the time that you're at the annual conference, which this year it's in Las Vegas, while you're eating your way through Vegas and whatever else, watching shows and things that you like to do, you can also be focused on not so much eating, but having that healthy lifestyle and trying to get your steps in. And a little competition, I think, for me, I'm highly competitive, I think is a really good thing to motivate and kind of create that sense of community.
Yeah, we also have done step programs as well. Actually, there's one going on right now, which is great because here in New Jersey, it's getting nice out and it's not cold. So it's encouraging people just to go outside and start getting their steps in compared to staying inside.
I love that. Well, we mentioned HIPAA earlier in the podcast, and we're going to include some links to some HIPAA resources in the transcript as well. But in the instance when an employee or employees are willing to disclose health conditions to HR, and they're also asking for support, where do you recommend that we as HR leaders start?
I think would be a good spot to first, before they even come, first get a list of health professionals around your area that are reliable and either take their insurance or near them, like a drivable distance, whether from like a dietitian to a primary care physician or a psychologist. It all depends on the health concern that the person is coming to you for. You want to make sure like you're leading them to the right source so they can get the right help. If they're concerned about their health in general, or maybe they see like everyone in maybe their office area is all trying to be healthy, the HR person should keep that all to themselves and between that employee, but also ask them, okay, well, what can we do in the workplace to help you? So you're putting really the focus back into the employee that's coming to you about the health condition, instead of saying, okay, we're going to do this or we're going to do that, or no, this isn't a good idea. Put it into the person that's coming to you and asking them, well, what do you think would be best to get you the help or get you healthier?
I love that. You're getting their input, and then they have a little bit more ownership into the solution. I also think it's great that you mention not just a primary health physician, but you're talking psychologists and dietitians. And I think that sometimes we forget about those other pieces of the puzzle.
Yeah, and then if you feel like there's a lot of people that are coming to you for the same situation, then maybe once a month you get someone to come in, like as I come in as a dietitian to a lot of places just once a month, and they can meet with me one-on-one, or we have the wellness coach, or maybe a psychologist can come for a few hours, whatever it may be. If you find that it's a common theme going on, then take an approach to that and trying to get that better so people can get healthier and work better.
As you're going into these workplaces and you're talking to folks and you're sitting down with employees, what are some of the most commonly asked questions or resources that they're looking for?
So weight gain and weight loss. I have some people with weight gain too, but weight loss is obviously the biggest thing, especially because it's summer coming up. And so we live right near the beach, so people want to get their beach bodies. That's a huge topic. And then I have a lot of people with high blood pressure, which may be from just the stress or from the salt intake or whatever they may be consuming, or no lack of exercise. Those concerns, I would say, are the biggest. And then recipes. Like I give out a lot of recipes or resources where they can find recipes so they can stop getting out of their normal boring chicken and broccoli, whatever it may be. People just get bored of a lot of things, which I do too. So you want variety. And if you don't have variety in your diet and you're not preparing properly, you're not going to be eating healthy. I mean, people come to work for 8 hours or more. They need to make sure they have their food for the whole 8 hours, or they'll go home and they'll eat the whole pantry, whatever it may be. I just feel like a lot of people need to be more prepared, and I'm there to help them get prepared. And it's cool to see when people come back and they're like, oh my gosh, it was much easier than I thought. I'm like, see, I knew you could do it.
One of my personal goals that I have been trying really hard to do is on the topic of dehydration. I'm trying to stay hydrated. And a recent study from the Georgia Institute of Technology in Atlanta looked at the effects of dehydration on focus. This is why I'm thinking about this a lot. As the participants lost more water, they increasingly made more errors during attention-related tasks. What would you recommend employers do? And also, I'm curious for myself, to solve something like this. Is providing tips for employees enough in this area?
Yeah, so hydration is like a hidden thing that people don't think about. And it's so crazy to me. They'll come and be like, Yeah, so I woke up and I had like 2 cups of coffee and I was like, okay. And then they're like later on I had like a tea and they keep going on and I'm like, okay, well, was there any water in there? I was like, we need hydration and we need water. You can also get water through your foods as well, but I want you to drink the water through whether filtered water, whatever it may be, even if you have to dress it up with some fruit or putting a reminder on your phone, or there's cute water bottles that will say like lines like drink me until 10 o'clock or good job, keep going. There's a lot of ways to get more hydration, but a lot of people forget, you're working so hard at your desk, you forget about drinking water. So a lot of people that I see, they drink maybe 1 or 2 water bottles a day, and I'm like, that's not enough. You're dehydrating your organs, and you need water for your skin and for your brain, for your organs. One example of maybe doing a tip for the employees, I know sounds weird, is getting a handout and putting it in your bathrooms at work and having a picture of what your urine should look like. So like darker urine is more dehydrated, but a lighter urine is more hydrated. So when they're going to the bathroom, they obviously can see, am I hydrated enough or not? Or I find when employers provide like the water jugs so you can just fill up your water bottle, those employees are drinking a lot more water than the places that don't have those water jugs. So it might not be that much more of a cost, and it might be way better for your employees. So I always want to encourage employers to buy them because it's so much easier to fill up the water bottle compared to having to bringing all the water bottles, which if you're bringing in the plastic water bottles, a bunch of those a day, it's not good for the environment, let alone constantly thrown into the trash. So I like to encourage people to bring their own water bottle and have the employers have the water fountain or whatever it may be that they can get water accessible to them. For the employees, they also might say, oh, I don't have a water bottle. So maybe the employers can that can be like a little Christmas present, and they can have like the company's name on a water bottle and give it to all their employees, and they just keep it at work. And so they don't really have a reason to not drink water because everyone was given a water bottle. And it's a reminder right next to them in their desk.
I love that. Switch out your coffee mug for a water bottle, maybe for your new hire gift or employee anniversary or like you said, holiday gift too.
Yeah, switch out the coffee mug. I love that.
I love that too. And I am sitting here staring at my glass of water. So as soon as we get off, I'm going to make sure I'll drink it and I will be good for the day on hitting my allotted water intake numbers.
Good job.
Well, Christina, thank you so much for taking the time to talk with us today. Where can people go to learn more about you and what you do, and then also wellness coaches?
Yes, you can go to wellnesscoachesusa.com to learn more about us. Also, my email is cduffieldbittner@wcusa.com. And then I also have an Instagram, and I have a food blog, so I share a lot of recipes on there too and some nutrition tips, and that is A Bit of Nutrition. So you can go follow me, and if you do have any questions, feel free to email me or to reach out to someone at Wellness Coaches.
I love the name of your blog and your Instagram. That's so fun.
Thanks.
Wellness Coaches was formed in 2002 to provide workplace wellness solutions that consistently deliver large-scale engagement and company-wide health, nutrition, and injury-related risk factor improvements. It has evolved to become the largest and most experienced on-site coaching provider in the workplace. And I'm glad to be able to have this discussion with Christina of Wellness Coaches about how we can better support our employees in workplace health initiatives. We'll link to great resources on the subject of wellness, HIPAA, and mindfulness, and more in the transcript of this Workology podcast. Thank you for joining the Workology podcast sponsored by Clear Company. This podcast is for the disruptive workplace leader who's tired of the status quo and who's also committed to drinking lots of water. I'm all about hydration these days. This is Jessica Miller-Merrill. Until next time, visit workology.com to listen to all our previous podcast episodes.
Production services for the Workology podcast with Jessica Miller-Merrill provided by TotalPicture.com.